agency. I'm here to do your start of care and admit your home care services.
I was a little concerned. You were supposed to be here 45 minutes
I
ago.
know. I was just running late. It's really hard to be on time when you're in the home care business. I didn't get time for lunch today. I'm sorry. If you mind if I have a nut?
Oh, no.
I need to pay your medications into the computer and reconcile them with your discharge instructions. Do you have those with you?
Oh, here's this.
Oh, okay, great.
Here's
Hold
my
on.
medication. There's
1 second. I just need to put these in the computer. Okay. I see you've been on all these medications before, so there's really no need to review them. Did you want to say something?
Well, yes, I have a question.
Oh, wait, hold on 1 second. I'm sorry. I just got a text from my son. I'm sorry. It's just, he drives me crazy. Okay, sorry about what was that?
This new medication,
Furosemide. Okay, yeah, that's Lasix. I'm very familiar with that medication. Furosemide is a loop diuretic causing fast and short diuresis. It possesses a sodium-losing effect and also decreases the levels of chloride in the blood and increases the excretion of potassium, calcium, magnesium. Furosemide is used to treat edema syndrome in patients with chronic heart failure.
I have heart failure?
I'm not sure, I didn't see that in the paperwork, but we can check on that later. Cirrhosis, disease of the kidneys, acute heart failure, pulmonary edema, brain edema.
Brain edema?
No, you don't have that. Hypertensive crisis and arterial hypertension and others. And you take it exactly the same time every day. Make sure that you take it the same time your doctor tells you to take it. There are also possible side effects, but we can talk about that later. Okay. I'm required to provide you with a copy of this. It's a list of all your medications. And now that I've explained and reconciled all your medications, I'm going to complete the OASIS form.
Really?
Mm-hmm.
Yes, hi. Hi, my name is Nurse Rachel Wright, and I'm from the PNC Visiting Nurses Association.
Okay, nice to meet you. Come
Nice
on
to
over
meet
and
you
let's
too.
sit down.
Is it okay if I place my bag on this chair and wash my hands before we
Yeah,
get
you can go ahead
started?
and put your bag on that chair, but my cats like to sleep on it too.
Oh, that's no problem.
And you can go ahead and wash your hands if you want, but my kitchen sink is dirty right now.
Oh,
I
that's
didn't get the
okay.
dishes washed up.
Oh, no problem. We actually have this hand sanitizer.
Okay.
It's just as effective as soap and
Okay,
water.
that'll work. I'm really glad you had that you called me ahead of time. I know that you normally plan your schedules, but you can't take into account things like the cone zones and the accidents and so forth. So that was helpful.
Oh, no problem. I want to be respectful of your time.
Okay, thank you.
Our discussion about your medications today is very important.
Okay,
Okay, so we'll discuss them today, and we'll also review them at each visit.
thank you.
We want you to be really safe when it comes to your
Yeah, I can
medications.
understand that.
Okay, so let's talk about them. Is this everything?
Yes, it is.
All of your prescription bottles? Do you have any injections or
No.
anything that needs to be refrigerated?
I don't have anything that needs to be refrigerated or injected, so these are all my meds, yeah. I take a lot of them, don't I?
It may seem that way, but remember, all of these medicines play an important role in helping you recover.
Okay.
Okay, it's so important for me to know if you can take all the medications your doctor has prescribed. And please let me know if you're not able to take any of them, if you can't afford them, or if you're having trouble picking them up from the pharmacy.
I'll do that.
At each of our visits, we'll talk about all of your medications. We'll talk about why you're taking them, how to take them, and when to take them.
Okay.
Okay, we'll also go over some possible side effects.
Okay.
So it's really important that you share with us during our discussions if you changed a medication you're taking or how you're taking it, or if you're having any side effects or feeling differently.
Okay.
Okay? We also recommend that you keep all of your medications together in one place. It might make it easier for you. Do you have a place where you can do that?
I have a container that I keep them in.
Oh, good. That's perfect. And before we continue, I'll need to see discharge instructions from the hospital. Do you have those handy?
Well, I have them right here behind me, so we'll just turn around here and get them. I had them on a file folder that one of them threw on the floor, so I knew where they were.
And I'll look through this. I will compare the medications your doctor prescribed on discharge to the medications you're taking here at home.
Okay,
I'll make sure there aren't any differences.
okay.
And then I'll make a list here, and we'll keep this up to date and accurate for you, and you can take it to all your medical appointments.
Okay. Yeah, that'll be real helpful because sometimes the directions that come home from the hospital aren't real clear.
That's
Yeah,
what's
and
nice about
and
our
the ones that
medication
come with
list.
the prescription bottles, you know, they have all those things all stapled together and stuff, and they can get to be confusing sometimes.
That's why our patients like our medication list. They're very easy to follow. We'll write down how much you're supposed to take, how often, any side effects, and the purpose for taking it. And then over here on the side, I'll write down what time of day you should take
Okay.
it.
Okay.
Lou, thanks for paying such close attention while I reviewed that medication you've been taking for a while. A lot of patients don't like to review those medications because they think it's kind of annoying, but I like to play it safe, and I want to go over everything because there may be some changes to the dose, or you might have some questions or concerns.
Okay.
Okay. Why don't we talk about this new medication, Lasix, that the doctor
Oh, is
prescribed for you?
that the furry one?
Yes, furosemide.
Okay.
And
yeah.
it's commonly called Lasix.
So Lasix is easier to say.
Okay,
That's
good.
like- That reminds me of that LASIK surgery, you know.
Well, if that's what it takes for you to remember, that's
okay.
fine.
Okay.
Okay, so
That's
Lasix.
better than saying furry. The furry thing.
Lasix is a diuretic or a water pill,
Okay.
and it's used to treat fluid buildup or swelling, and also high blood pressure.
Okay. So why I'm always peeing a lot because
Yes.
it's a water pill? Okay.
Yeah, it will make you urinate more often.
Well, that's sometimes why I don't take it in the morning, like if I'm going out someplace, because, you know, I don't want to have to deal with all of that while I'm running around.
Well, that's why it's really important that we're talking about this, because I want you to take it every morning as it's prescribed by your doctor.
Okay.
He has here that he wants you to take 40 milligrams by mouth every morning. Okay,
Okay.
so that's one pill every morning.
Okay.
Okay? It's also important to know that when you take Lasix, it can rid your body of potassium more than it normally would. So it's important that you eat foods that are high in potassium, and that's also why your doctor prescribed this potassium supplement for you.
Okay.
Okay?
So am I supposed to still eat, like those, when you said the high potassium foods, I know some of my other friends that take water pills will have like a banana every day or drink some orange juice every day. Is that what you mean?
Yes, that's
Okay.
perfect.
Okay.
And I'll give you some more information on that diet
Okay.
later on if you want.
Okay.
Okay. Some of the other side effects that we really need to be careful of when we take Lasix are lightheadedness, dizziness, and weakness.
Okay.
The lightheadedness and dizziness can really happen whenever you stand up from a seated position or whenever you wake up in the morning and get up right away from bed.
Mm-hmm.
So you want to take it slowly and take your time.
Okay.
Any new medication can cause side effects, so it's very important that you let me know how you're feeling and if you're experiencing any of these side effects. Will you do that?
Yeah.
Okay, great. Let's review. Can you tell me 2 of the major side effects you should look for when you're taking Lasix?
Well, you mentioned about the dizziness, especially and lightheadedness, especially when I was getting up in the morning, and then you also talked about the potassium thing, which is why the doctor's given me that big potassium pill to take, and then and that I should also take it with some orange juice or a banana if I wanted to, and then of course I know about the peeing already.
I'm sorry, Lou. I've been doing so much talking here, but I really want to make sure you understand your medications. Do you have any questions for me?
Well, you went over the side effects really well, but I did have a question. How long am I going to be on that furry thing? You know, the Lasix.
Furosemide, Lasix. I wish I could tell you how long you'll be taking that, but that will be up to your physician. He'll figure that out after he makes his assessment of your condition, and we'll be talking to him regularly. But please don't stop taking any of your medications, especially the Lasix, without talking to him first.
Okay.
Okay? I really want to make sure I explained everything clearly to you. So, if you were going to tell your daughter about this medication, what would you say?
Well, I'd tell her that it was a water pill and that it was probably going to be helping my ankle swelling or my blood pressure, and that I have to get up slow when I'm going from sitting to standing or from lying to sitting, something like that, that I could get dizzy or lightheaded. And then she's not supposed to eat the last banana in the house because I might need it. And then, you know, she already knows I have to go to the bathroom a lot.
Okay, great. Again, Lou, thank you so much for taking the time to sit here and talk with me about all of your medications. I really appreciate it. We really just want to make sure that you're safe.
Okay. Yeah, I can understand that.
Hi Lou, my name's Thelma Thurrow, and I'm going to be your therapist today. Okay, but before we get started with your therapy, nice meeting you too. I just wanted to know about your medications, and do you happen to have a medication list handy?
Yeah, the nurse said that you would need, that everybody would need that on a visit.
Okay, great, thank you. Now I wanted to make sure that there weren't any changes with your medications and how you've been taking them. We just want to make sure that we're keeping you safe, okay? Now, how have you been feeling? Have you had any side effects from your medications, or are you having any pain with anything?
Well, I'm not really having any pain, but you know, the nurse mentioned about getting dizzy, and every once in a while I feel dizzy in the mornings when I get up, like kind of a little bit today too.
Well, that's a very important symptom that you shared with me, Lou. Now, I would like to look at this medication and compare it to the side effects in the computer. Now, how about your exercise program? Have you been able to do that?
Well, that kind of depends on how I'm feeling. Like if I'm feeling dizzy in the morning, I don't always want to exercise. And then sometimes if I take the water pill before I exercise, then I have to interrupt the exercise program to keep going to the bathroom. So, I mean, most of the time, yeah, but sometimes no.
Okay. So do you mainly do your exercises in the morning or at different times of the day?
Yeah, I like doing it in the morning.
Okay. Now, how about if I take your blood pressure in several different positions when we're doing your session today? Because I just want to see if that changes at all.
Okay.
Okay. And now, how are you feeling good now? You have no dizziness or lightheadedness? Okay. Well, how about if we get started with some exercises, okay? Can you lie down for me and swing your legs up here? I brought along some TheraBand with me today to work on building your strength. Did you ever see TheraBand?
Oh, those are the rubber bean things.
Yes, this is green. It's a little more difficult of a resistance as the red.
Okay.
Okay, but we'll
Yeah,
work
some
on
kind
this.
of colors.
Okay. Now, Lou, with the TheraBand, we can start building your strength more.
Okay.
It'll help make you more safe and stable with your walking. And I understand one of your goals is to get outside to get to the mailbox and out to your car. Okay, great. Now, I'm going to put, just looking at your foot here, you do have a little bit of swelling in your ankle. And the elastic from this slipper is really tight. Did they usually fit this tight on you?
No, I don't.
Okay. Well, are you sure you were taking your medication this morning?
Well, remember I said I got a little dizzy yesterday, so I didn't really want to take it today.
Okay. Well, I really don't want you to be fearful about taking your medication. So what I want to do here is talk to with you about your concerns, and then we'll notify your team leader, and then she'll give you a call. And she'll contact your physician.
Okay. Yeah, because I don't really want to wind up back in the hospital.
Oh, I don't blame you.
Right.
And what we need to do ask the physician is if there's any changes that need to be made to your medication protocol.
Okay.
Okay. Now, Lou, it's really important that these medications are reviewed on every visit. We have to keep you well informed and safe, okay? Now, if this would happen again, what do you think you might do?
Well, I could call my nurse, or I could call my doctor, or I could call both.
That's a really good idea. Just keep us informed of what's going on, okay? Thank you. Well, Lou, thank you very much. I think that session went really well. How about you?
Yeah, I think it did too.
Good. Thank you. And you know, it was really important, and I appreciate so much that you told me about your side effects of your medication. Because it's important for me as well as the nurse to hear that information so I can do my job effectively, okay? Thank you very much for that.
Okay.
Okay.